Oh, hello everyone. How are you today? I hope you're all doing well, and it's always a pleasure to take time and talk with you about your health and help you get on your journey here, and particularly the spiritual journey. You know, that's the best. I mean, there's nothing like God absorption, where it's the ecstasy of freedom and the allness. I don't think Americans have understood what the Constitution and all that was about, and who the framers were here in the United States, you know, and how important that document is to preserve as a form of spirituality even, you know. And it's hard for the average person to understand the need for freedom. And this country's rapidly taking everything away. Cameras down our highways now. I mean, it's not even funny at the rapid loss of the positive forces and the negative forces infiltrating the states here. It's amazing stuff. So that's why worldwide you guys are so needed as the light of God, to bring in that love, to bring in the humility, to bring in the power of truth, how simple healing is, and to get on with other things like your growth and touching the fabric of the infinite, that which has created all things. And these things that are much more important than these little dramas that exist constantly at all levels, you know. Creation is just one big drama, you know, just infinitesimal amount of little soap operas going everywhere. It's almost funny sometimes when you look at that, you know. And at the heart of it, you know, is God just watching it all take place. Anyway, I want to shout out to Angel Man. Look at this good-looking guy. Look at that muscle guy. Back in the day, baby. Thanks, Angel. You're a good man. Love you too, man. Good job on yourself. You know, and I tell you, it's what you do. You are now involved in survival. If you haven't noticed, this planet is changing rapidly, and now we're moving towards survival mode. Forget the cushy days of the 60s and 70s, and so we're definitely moving towards survival mode, both in diet, food sources, good food sources. You always have those willing to destroy and break down, and we have to represent that which is strong and builds up, and, you know, the health side of it all. So keep working on yourselves out there. You're doing great. I know sometimes it can be a chore getting yourselves well. And I think that if you understand that the fruits and the berries and the melons, they rank at the top of your food chain for Homo sapiens. And good quality fruits and berries and melons. I talked to you about a professor. He's a 3-doctorate professor. And even though the blueberry and the banana was his main study, it was apparent in our conversation that the fruits and the berries in particular are where all the massive nutrition is on the planet. And I think what's important is that we lose these antiquated concepts of proteins and complex sugars like grains and anything that these are healthy. I actually stepped back getting into health food stores. I thought I was doing good as a raw foodist and as a fruitarian thinker, but in opening up a health food store back in the early 70s, I started drinking the raw milks, thinking, you know, raw milk, yeah, you know, all that sort of thing. And nuts, yes, nuts, they're natural. And so I started eating this way and seeing my health going back the other way. After I spent all these years detoxifying and fasting, I started seeing my body filling back up with mucus, and I had all these raw milk yogurts, and I'm going, oh wow, this is so good. And it's like, oh my God. So this is how we learn. And so if I can help any of you guys not to have to go through some of those things and waste a number of years learning what's good and what's not good, let me do that. Because I wasted a lot of years, but then that's what gives you awareness and wisdom and things like this, is when you go through these things yourselves. It's just this, you can't expect perfection at this level. even though in one sense of the word it's all perfect. But creation is what it is, the drama of life, good, the bad, and the ugly. So I want to get to some of your questions here, and I'd like to catch up here a little bit. I wanted to come in this weekend, but I was just bushed. Please, Dr. Marks, talk about vitiligo. And this is a 23-year-old. She has vitiligo for 4 years now. All right, so we automatically know that the pituitary controls the skin pigmentation, and so this is a pituitary problem. So definitely a couple of things you want to think about when you have vitiligo. And that is, you've got to think just like everybody else. First of all, I've got to get my body alkalized. I've got to get my body hydrated. I've got to get this lymph system filtering through my kidneys. I've got to get all the congestion out of my sinuses, out of my bronchs, out of the walls of the bowels. I want to get digestion. I want to get absorption. I want to get utilization, endocrine glands, and I want to make sure I'm moving my digestive waste through my colon right, and I want to make sure that I'm moving my cellular waste through my skin and kidneys appropriately. That's essential before you can say, I've got vitiligo and I need to change this. Well, you have to first go through this doorway to change, because the reason you lose these things, again, and let's go back to Dimitri here, 10 days on a water fast, his fingernails get hard. He wasn't consuming nutrition. And so what that shows you is the suppressive nature of the lymph system, whether it's the parathyroid, whether it's calcium utilization in the body, whether it's in the arms and hands, back of the neck, blocking proper blood, nerve, and lymph flows. All that lymph gets hardened, gets saturated, because it saturates tissue. It's the interstitial fluid that flows around all tissues. So it hardens, it swells tissue, it suppresses blood and lymph flow. It suppresses the action of cells, be it the thyroid, be it the parathyroid, be it the pituitary, be it the kidneys. And since we're dealing in sinuses and what dairy products generally affect, generally head down to the gut, that has to be understood then, that you have to get in these tissues and clean this out. And then, of course, you've been in your mom for a few months there, and that's lymph congesting right there, depending upon the mother, because you're tied right into her blood and lymph. So this is a big deal. So this is why no matter what you're facing out there, you have to go through this detoxification road. This is the road to Wellville. There is no other roads. There's therapeutic roads that lead you a little to the side, a little over here, because they're helping you with symptomology a little bit, whether it's pain or whatever. These therapeutics are just little adjuncts on the side of the road. You can stop and get a little breather and get some things moving a little bit. But the road to get to Wellville is a road where you must restore hydration interstitially. You must get filtration of the kidneys, the sweating of the skin. You get your endos up and turn on your autonomic nervous systems again, because these are all the things that are down in most humans. And so those are the things you have to do. In that process of cleaning the sinuses and everything, the glands will turn back on. If you're removing that which suppresses or that which enhances, because acids can create a hyperactivity of a gland as well as a hypo. So you just have to understand that when you look at cells, the immediate effect of a cell is the fluids around them, and that's blood and lymph. So just in consideration of that, which site of chemistry does each fluid deal with predominantly? And then that leads you into the lymph and the acids when you're looking at the corrosive side, or the side of chemistry that can offer more harm. There's no questions high alkalis can, but you don't see much of that. What you do see is high acidosis, not alkalosis. And unfortunately, a lot of biochemists get their scruples turned around. It's evident, obvious, and you don't need a chemistry book to tell you. After you get a certain knowledge of chemistry, it becomes quite apparent. Look at all the cycles. Look at the Krebs cycles, and look at what spawns off of all these cycles. Acids, always, not alkalis. So I'm a young girl and hate to watch my skin change in color. So I would definitely, for me, I would take a pituitary glandular, no question about that. Since a pituitary is a small thing, I'd probably only do one twice a day. Maybe, I mean, you could try for one bottle, 3 times a day to really hit that pituitary. But you have to understand that you also want to get that lymph and blood flowing through all tissues. This turns on because in the blood you're energizing it. You're eating electrically alive food, so you're bringing energy, electricity into the body. This has an effect through the nervous system of turning things on. There's another thing man doesn't talk about. It's not just about chemistry. It's about electromagnetic energy from the foods that you're eating. And they give you energy. They come with their own digestive power. That's the beauty about raw foods, that they help to digest themselves. You just have everything to the positive. This is why animals don't eat cooked food, and when you feed your animals cooked food, they get the same problems we do. Feed a dog off your kitchen table and watch him get the exact same problems you do. I mean, it's well documented. You can see that all the time. Because we are only geared for a certain form of food, and we've crossed that border, the red line, as someone has said. We've crossed that red line into the danger zones, and we've done this for millennium. And so for some, not the islanders, but for some, particularly the northern people, big trouble in Little Texas there. You got to get in and repair things. These high-protein diets have done nothing but wreck the bowels and the urinary tracts. So the eliminative organs in man are horrible. And these are areas you have to rebuild. And I tell you, eating the raw and eating the fruits and berries, it's just enlivening. It's enlivening to the cells and to the body, and enlivens the fluids and activates and turns on and hydrates. And that's why the raw is key essential. No animal cooks their food before they eat it. Why man does is beyond me. And then to make a claim that it's healthier is shows brain fatigue in those that would make some of these claims. Those that think you have to eat all these dead tissues to, especially animal meat, to have brain functions and stuff. These guys are delusional. You know, these things are ridiculous. It's one thing to have a little dead tissue once in a while just as a habitual thing, but it's another thing if you think there's anything associated on the health side of that. That's ridiculous. Meat is putrefacting. It's on well by the time you get it on its way to putrefying, well on its way. You know, aged beef is 6 months hanging or more. You know, and you can see what happens to dead tissue and it hangs in nature for a while. You know, it gives you an understanding why bacteria and worms exist. So, you want to go after your pituitary here for sure. I'm trying hard not only with creams, yeah, that's not going to do it, and UVB laser. I'd be real careful with the UVB laser, sweetheart. I would be very cautionary that you think you're going to change your pigmentation without affecting your pituitary. You got to go right to the gland that controls skin pigmentation, no question. Upper circuit, brain, and nerve are two formulas that I swear by in my own world because it just enhances comprehension, enhances brain function at all levels, including the hypothalamus, endocrine glands, pituitaries, all these things. Brain and nerve is an incredible formula. Upper circulation, two things that I would aggressively take with this. But I'm also watching my diet, having vitamins like B12 and other things. Well, you know what? Don't waste your time in that way. If you want to take a supplement, go to a superfood blend. I don't care whose superfood blend. Read it. Don't take superfood blends where they've added probiotics and digestive enzymes and crap like that. Get a true, simple superfood blend that has simply the superfoods of nature. And some of the superfoods of nature is going to be your alfalfas. It's going to be your royal jellies. It's going to be your berries. These are the superfoods. Kelp's a superfood. These are superfoods. But when you have a superfood blend, you don't need much. I'm telling you, you've got so much nutrition that you've got to worry about your body's able to metabolize it, to digest it, to absorb it. All these factors that are essential no matter what you're taking. So when you go through the world of detoxification, you're adding the foods that are the most nutritious on the planet, the most powerful energetic on the planet. That's a given. That's a given. So you don't have to worry about the nutritional side of that. If you do, then take you some superfoods and forget it. Or you're going to wreck, you're going to lose energy in thought processes, worrying, are you getting enough? And is there a vitamin or mineral that's going to stop the renin or the skin pigmentation changes? And the answer is no, that is hormonal, that is pituitary. And you got to work on that. And you might, I don't know, you haven't said anything about your height, but it affects height. You're either too short or too tall. Also, it affects a female's menses, irregular monthly periods, heavy bleeding cycles, things like this. I really wish that you could talk about vitiligo. Doctors keep telling me that they still don't know the reasons. Holy crap. I mean, you know what? I mean, you got to go back to simplicity, because the mind has gotten so intellectual that it doesn't know. It's confused itself. Because it's too simple for the mind to understand that the body is nothing but cells. Each cell is its own individuality, its own individual, whatever its job is, whether it helps with skin pigmentation, deals with the renins or the skin pigmentation, or whether it's adrenals and your cells deal with cortisols or progesterones or estrogens. Doesn't matter. These are all cells. And the health of the cell directly is involved in consumption and elimination. Consuming the right foods and eliminating the waste, everything gets healthy. Your car motor, if you keep it cleaned and you keep good fuel flowing through it and keep your fluids moving well, your motor will last forever. And that's exactly what one has to do. We're building obstructions and restrictions to the flow of blood, nerve, and lymph. And this is why we're obstructed. We're constipated lymphatically. Now, the other thing here is, I can tell you that to have a pituitary down, you're probably going to have some transverse colon problems too, sweetheart. And this is the bowels, and this is why you must always go to the bowels. That's why fixing up the body, even though your bowels are down here, your pituitary's up here, the body works synergistically. The body is a one. It's just like all of us. We might be individual, but we're one. We're working as a team. And you guys are showing the power of healing as a team. And yeah, we all are learning. You guys on Facebook are learning a lot. That's excellent, because that's what this is about. And you just getting your hands wet. You're helping others. And that's what this is about. We should never think about perfection in these things, because health is simplistic. We've made such a big deal about it. People are afraid to do raw foods. People are afraid to detoxify sometimes. And it's like, what? You know, the average person rather run to an MD and go that route. It's like, oh my God. So now that they realize there's no remedy down that road, and we're realizing it faster and faster, then they're finding the roads that have the remedy, and they're finally getting to this road that you guys are already on. And you guys are becoming the teachers, the way showers. And that's what this is about. You're getting your godly side together. And that is key for your survival, as well as helping others too as well. So it's a buddy system here. And I think if you look at everyone as your friend, even though they might have an attitude or something that's not, they've copped on, it'll break down. And I'll tell you something, this is the other reason why humility is always good. Because if you don't, there's something going to knock that chip off. There's something going to knock that ego down, and it's just not worth it to me. I'd rather be humble. Thank you very much. I love you all, and stay in the graces to be. Karma is a double-edged sword, and it's just, you get home down here. And so, you just keep that love going, and you keep working with others, and then that brings love out of you, and that makes you feel good, because the only thing that's worthwhile right here is yourself. You're the only one experiencing everything, including watching this video. You're the key. You're the key to your wellness. You're the key to the the heavens. You're the key. And it's only through you that all this can be experienced. So you're the key. Each and every one of you. You guys are the key. And you have to spend time alone and enjoy yourself as the key. And relax more and play more. and wrap yourself around flowers more. Get into some creative arts. Turn the mind off. Let it take a hike for a while. It'll always be there when you need it. Doctors tell me they don't know the reasons behind the skin disease. It's not a disease. It's not a disease. Your pituitary isn't giving you the hormones you need. But after listening to your lectures here, I started to believe more that everything happens for a reason and that something needs to be treated. Well, no kidding. Please respond. Absolutely, sweetheart. By the way, my situation is not that bad yet, and my white patches are small. Oh, good. Because we've got, we definitely have all levels of that. I know I was working with a lady in Hawaii, albino, and it's like, you're talking about a lot of work to turn around an albino a little bit. But you know what? That's an individuality. It's a beauty. So I don't know what to say other than always go for the health. And you got to dig deep sometimes into the body. And getting up here in the head area, you've got to clean up the bowels. You got to clean up the kidneys and skin. You got to get everything filtering and turning on and everything else as you guys know it to be. And then health will come right your way. Absolutely. Later, I already started to find 2 other spots, and they are being treated. Well, again, treating spots that's not what your gig is stopping, is getting the pituitary up and running again. Oh, it's going to affect your monthly cycles and everything else there, dear. Question for Dr. Morse. My mother has osteoarthritis in her cervical area. I take that to the upper neck area. I have read that the cartilage that wears down in the joints never rebuilds again. Is that true? I disagree with that. I think your whole body can rebuild itself again. Now, have I had a lot of cases where people have done that? No. Because people only take it as far as they want, and then they're done, and then I don't see them anymore. So we have a lot of people out there that accomplish great things that you don't hear about. We've had that happen to us a lot, where we heard about cases and we go, wow, they never called us and let us know, So it's always exciting. And I think that when you take a look at where man is, he doesn't see regeneration. You guys are the only people going to see regeneration. Those that have went to these higher levels, you're the only ones going to see regeneration for the most part. And this is why a lot of even naturopaths, they don't see it, so they don't believe it. And that's the problem. They never participated in conscious detoxing, conscious rebuilding of their own body. So how could they see it? And that's the problem. Going to school doesn't educate you, if you know what I mean. You guys are getting the best education you could ever get. First, you're getting all the goopah that I've had 40-some years at. You are riding the bull yourselves, which is the key here. And you guys are the finest healers in the world. Even though not everybody's perfect out there, but you guys are getting the knowledge that you need to not only get yourself way to Wellville, but everybody else with you. And that's key. You can't go to school and get that information. You just can't do it. This is our school. These videos, and then our classes, and those that dig out more. Some of you YouTubers are going to get way out there and experience things that only a few can deal with in these more advanced classes, because you're taking yourself into worlds that few have tried. There's not a lot of people that have tread deep into the interstitial rebuilding of the human body, and you guys are. And it's just, I'm blessed to watch and be a part of helping you guys to achieve this, because it is so cool. And it is the end thing. It is the thing that will save this planet, if indeed that's the issue. Definitely affects the human state of consciousness, which no matter what planet is next for that soul, it is an upliftment. So very essential. She wants to take collagen and hate the idea it comes from animals because I'm vegan, but I don't know if that would make any improvement at all. I would check her parathyroid gland and really look at that, a detoxifier, and get her lymph moving, because that's why. Always address the why first. Why would you lose cartilage, or why would you lose bone, or why would you lose connective tissue anywhere in the human body? And the word is going to keep coming back, acids. You get tight upper necks and stiff upper necks, that's lymph. It's going to start chewing on you. And that's just exactly what's going on. So to rebuild that which is being broken down is to remove that which is breaking it down. It's that simple. Well, there's only two sides of chemistry and two major fluids of the human body. You don't have a lot to pick from, which simplifies it for everyone. And that's the way it's supposed to be anyway. So, just pick that, know that's the acid side, get your kidneys filtering, that's always key, look at the urine, make sure there's sediment in the urine, get those adrenals up, and then definitely go after the parathyroid. Make sure that the fingernails are strong, there's no bruising, that all the varicose or spider veins are pulled back into the body, make sure the skin is toned and tightened and not wrinkled. All these things are part and parcel to this whole calcium acid scenario that's going on. You could say calcium or cholesterol scenario that's going on. You could say calcium, cholesterol, and edema that's going on. These are the three issues constantly observed under a highly acidic environment. Calcium loss, cholesterol plaquing, and edema. And it all fits when you understand that acids dehydrate. Acids have to be stopped, basically by a lipid. Hard to stop an acid with water solubles. And then you've got your calcium, and it'll be pulled out of your back, out of your connective tissue in your vascular walls, which leads you varicose or spider veins, petechia in time where you bruise easy. And wonder, oh, look, I wonder how that happened. Those things lead to aneurysms, herniations, things like this. And so you can repair all these things. It's just that locations make it difficult sometimes, especially herniated groin herniations and stuff. Hard when you're always active and pressure, but you can fix all these things. The body rebuilds itself. There's no question about that. And you guys are creating the environment for that to happen because you know the environment of decay falls predominantly on the acid side. So by returning the base balance, the alkaline balance, then you're going to have hydration and rebuilding. And it's just the nature of the beast. But you have to really get this, get these kidneys and the skin and the bowels and everything back in a shape of a proper elimination. And then you are well on your way to moving that which is breaking you down out and returning interstitial hydration. Inflammation is gone. Of course, that's the response mechanism to acidosis, or what you want to call proteins. I mean, take a look at this. Proteins is the most immunoresponsive of any chemistry out there. And yet they tell you to have more of it. I don't know if it would make any improvement at all. Is there something natural like herbs to diet change? Oh, absolutely. Nadia, thank you, sweetheart. Absolutely. Hello, let's see. Her name is Kai, Kaya. First, I would like to thank you for what you do and helping all those people. Oh, listen, you guys are helping too. We're a team. And that's what I want you to realize. We're a team working together to help the world. And that's important, that you come aboard with that, especially yourself first. And don't feel ego, it's yourself. You've got to always fix the self. Some of you don't love yourself enough, and you need to. You need to start loving yourselves. You're all so beautiful, every one of you. And you must come into that and realize you have consciousness. Enjoy that beauty of awareness. Doesn't matter about the body. It's just a body. It's just a vehicle. You can always fix them. But it's a consciousness, the fact that you have awareness, and how that awareness is part of the all awareness. It's just, come into your own divinity and realize the beauty of yourselves. That's key here. And that's the motto of today, by the way. It seems like it is quite rare occasion these days if you find someone that is honest, have integrity, and have courage. Oh, thanks. I hope they're talking about me. I'm trying it, but I hope we're talking about each and every one of us, because that's what it takes. We have to stand up no matter what. Look at Nelson Mandela. Now, a lot of people think different things about him. I don't know. But there's one impression that he left, and that is, the years of being confined and the need for freedom and stuff. That's an echo that's coming. And unfortunately, we have the people involved here that want to take that freedom away again. They want to throw people in prison. The same thing is happening here in America again. You know, the government is overreaching and wants to create a control mechanism, cameras, and I mean, it's just out of control. The fear, because the government's got so corrupt now, they fear the very people that they're supposed to be over and help, because the government definitely fears American people. This government knows what can happen here and what's coming if they don't get their act together. It's just inevitable. I am studying biochemistry and have always believed that different degenerative conditions can be turned around for the better and bodies can even be fully restored. It's nice to find someone that confirms my belief. Absolutely, and we all should be, you must believe that. If not, you're trapped on only one side of duality. This is duality. Duality means you have both sides. You have males, but you also have females. You all have base and alkaline chemistry. You also have the acids. You have regeneration, degeneration. Absolutely. We must realize duality. But we have modalities out there, what they call health modalities out there, that don't understand that and are lost because of their high intellectualism and on a wrong focus. I have been to the doctor, allopath, several times over the years for different reasons, and it has always infuriated me that if someone that if someone tells me that I have to accept to live with a condition for the rest of my life. And you bring up a good point. And this is what I hate when some oncologist says, well, you got about 3 weeks or you got about 3 months. Holy crap, I just hate that. I understand their game of let's see how close I can get this time, but I'll be honest with you, you really, you don't take that at all. And I love this person, this Kaya, K-A-I, I don't know how to pronounce that, country boy, but it's enough to say that I'm 100% with you. You never count yourself down and gone and out. Ever do that. You're all too good for that sort of thing. I'm very glad I have found your YouTube channel and the information you provide, since I'm currently working to get my health back from years of abuse. Therefore, I have a couple of questions. I'm 31 years old, and from the information you have provided, the symptoms I have had, it is not hard to know that I have kidney and adrenal problems. Yeah, especially at 31, that's the thing. 31, you do, and you just really want to pee in a jar, make sure you're filtering, go after those kidneys anyway, the adrenals anyway, check your blood pressures. Most of you are going to see low blood pressures. You want 120/60 if you can get there. If you're in the high blood pressure, that's low blood pressure. Get your kidneys filtering and your blood pressure will come right back down. These things are easy to fix. Now, there's some things that are deep in the tissues of the body, going to take a while to get in there, no question about it. So, some things are easier than others, no question. Therefore, excessively backed up lymph system. I have figured out some things out for myself, but I have a question about the skin and body temperature regulation. You've suggested that if a person feels cold frequently, it could be thyroid problem. My issue is that I get cold very easy, but at the same time I overheat real easy with excessive sweating. That's probably neurological, sweetheart, and it's probably autonomic that you're seeing that happen, and that could be coming out of the stomach area here. I mean, it could be coming from the cerebellum too. There's no question about that. So either from the parasympathetic side here in the cerebellum or in the stomach ganglia where this autonomic comes together, that's probably what you're going to see. Now, you could have, even in the thyroid, you could have that what we loosely call bradytachy or hyper-hypo, where you see some flipping. Even to say that this could even be coming from the pituitary. So you have all these possibilities. I would say, one, get an iris analysis or get a picture of your eyes and take a look at that and see if you can identify, even though you're going to do the same thing, except if you don't have a pituitary, you might be not take a pituitary substance. But I would detoxify myself. If you have a concern that your gland is hyperactive in any way or visits that, then don't take anything for that gland. Like if you feel like your thyroid is low at one time and then shoots up high at another time and the pulse rate goes up and everything, I probably wouldn't take anything for the thyroid. Detoxification will handle that appropriately. And that would be either some chemical, iodine, or some lymph acidosis creating a hypoactivity in that thyroid tissue. So it can even be that. So either way, you're going to detoxify. You're going to clean up the bowels and the gut, because a lot of those type of symptoms come right out of the stomach. So you want to really get that cleaned up and the bowels cleaned up and that sort of thing. At the same time, you can empower with an endocrine gland formula, very gentle endocrine gland formula. If you need to take a glandular for the adrenals, okay. And then an endocrine gland formula for the rest of the body. These are herbs or berries. They're gentle on the body in that respect. But detoxify, clean all the congestion out of the sinuses, out of the thyroid and parathyroid. Get your bowels cleaned up so they can drain well, get your kidneys draining, and I think you'll find that symptom going away. There's also those that feel cold that are burning up, and that is systemic acidosis. And that's another sign where you're cold, but you're burning up. And this, again, this is high acidosis of the human body, but the thyroid is down. And you just got to get in and hydrate interstitially to remove this burning, because this kind of burning isn't fun. This kind of burning can lead to the breakdown of cells eventually, and then the C word. So, not sure if that would suggest low thyroid activity. It could suggest a flipping thyroid activity, actually. Or, again, an autonomic neurological response from acidosis of the gut. Could be based upon a spasm in the stomach or colon even, that from different foods passing through that the body didn't like, or inflammation or bowel pockets or whatever. You have a spastic bowel that can actually trip the autonomic and give you a cold sweat. I mean, it could be all kinds of things like that. So getting into the body and getting the kidneys filtering, getting the bowels cleaned up is a sure remedy. Seen a lot of that through my life. Sure remedy for all of that. Maybe I should think more of pituitary gland since I have irregular periods. All right, okay, so right there you go. Now, I love the way you guys are thinking, and this is exactly what I hope these videos do, is educate you to this level of thinking where you're associating and you're relating here. And absolutely could be pituitary. If you have sinus congestion and stuff, this could be part of that too, tripping the pituitary up and off. So that's another thing to think about. Irregular periods would definitely be the pituitary. So you could do a pituitary glandular. Just do like one in the morning and one in the evening, 2 pills a day maybe. Work that way. You could go by the back door and use the female reproductive formula that has Vitex or Chase Tree, which is pituitary berries. The endocrine gland formula has the berries for the pituitary and stuff. And work with that a little bit. We just talked about vitiligo, which is a pituitary problem as well. I should add that I have very poor circulation, currently taking brain and nerve and upper circ. Oh, good, smart thinking. I was going to say that upper circulation and brain and nerve are 2 key factors to get to the pituitary and hypothalamus area and all of it. So smart thinking. You guys, mwah, I love you all. You guys are really getting what you would do on yourselves. And when you get what you do on yourselves, you know what you're going to do on all your friends and all the other people that are suffering. You know the tools that you can use to help them. That's why you guys are so valuable to yourselves. What you're doing now on yourselves and what you're learning isn't just about it's about the helping of mankind and helping of others, helping creation in how it's regulated and how well it takes care of itself. There's all helpers at all levels, some seen, some unseen. And there's always the 9 silent ones. There's all levels of beings helping the world at all levels. And it's just a gigantic thing. And the more that you quiet that mind, enhance the consciousness, you're going to see some of these things. That which you didn't see before makes itself known to you. So it's cool stuff. This is a smart girl here and have had it for a long time. My overall body temperature runs a little bit higher than normal too, normally 98.3. That's what I'm saying. You're probably flipping up and down a little bit where you're running hypo, where you're going up too hot, going down too cold. That could be regulated from the pituitary, absolutely. Could be spot on, all right here. Nothing down in the gut. Or it also could come down in the gut. Could be the transverse bowel tripping out the pituitary and that. So that's why I say it's essential to clean and rebuild the kidneys, the adrenals, the GI tract. All these far reach out and touch all parts of the body. So yeah, they're smart. You guys are smart. I love this. I think my blood pressure runs about 117/74. So, you know, that's not so bad. 74 should probably be more in the 60s, I think, with good kidney function. So, might show a little bit of kidney there. That would lower the 117 down a little bit, but it's still not too bad. Try blood pressure, both sides of the body, of course. You got an adrenal and kidney on both sides. You're going to have a different blood pressure on each side, depending upon the weakness of each kidney and each adrenal gland. I guess it is tiny bit low, but not bad. So, that's good. I do know that I have nervous system weakness indicated by high levels of anxiety and nervous behavior. Yeah, I would definitely head it up with the adrenal glands, that's for sure. I'd like your take on the pituitary here. I think you're spot on with that, no question as far as that's concerned. Now, whether that's tripping up the thyroid with TSHs flipping back and forth, that could be all coming from all this inflammation in the head area. But get those sinuses drained. Try to have a cold and flu-like symptom. Go hug somebody that's sick and hope you can get something. You know, you really want to detoxify the head area out. And really, cleaning up the bowels is helpful to that end. Fresh squeezed navel orange juice, baby. Oh. Excuse me, I'm experiencing a little bit of nirvana. Bought 3 big watermelons. They were big. I take them from Guatemala, I guess. So far, the first one was like, All right. I do know that I have nervous system. Another thing I cannot really figure out very well is that I have very bad skin. Well, you know, you could have ran low thyroid, and now it's kicking up on you for some reason. Whether it's the upper circ doing it or whatever, brain and nerve, or maybe it's just the acidosis that set in more. But you're probably coming out of a genetic tree of thyroid, because generally when you see bad skin, you're generally seeing thyroid. Now remember, the skin is your third kidney. So when you see skin problems, you automatically know you have 2 kidney problems. Automatically. So you're not filtering. Because when you're filtering well, the body doesn't have to burden the skin. When you're not filtering well, the body has to burden the skin. So if you have bad skin, 1, check your thyroid. 2, get your kidneys filtering, your 2 other main kidneys filtering, and that'll pull the acids and balance out the elimination of the body, and the skin will clear right up. Essential. I have had extremely dry skin since birth, since birth. So you have literally been extremely dehydrated since birth. Means that you got a lymph condition from your mom, probably, that's systemic. And then with maybe low thyroid or low endocrine glands, all this is help. But this tells you the dry skin, very acidic from birth on. This lady's 31 now, so she's been fighting a lot of acidosis and still have it, plus lots of breakouts. And that'd be common. So, you know, you can dry brush the skin, use a skin formula, but the only thing that really works is get your kidneys filtering again. Get those 2 kidneys filtering, get your adrenals up. This will take the pressure off the skin, start detoxifying, get your body hydrated now, because that's really key, because you don't want to dehydrate in the brain either. I guess my question is that, why would I have strong nails? Well, that's a good thing. You can have strong nails. I'll tell you what. Take a look at this. You're running hyperthyroid. You're starting to run a little hyperthyroid here. Well, if you're going to run a little hyperthyroid, the possibility of running a little hyperparathyroid is also true. I've always said, you show me a hyperthyroid person, 1, they can eat all day long and not gain any weight, which I used to hate that. But 2, if that parathyroid is hyper, oh baby, you couldn't break a bone if you wanted to. That's the other positive side of a little hyperparathyroid gland, is that you can have strong, wicked fingernails, but just from the overutilization of calcium, from an extremely well utilization of calcium. Seen that before. I've looked at that, matter of fact, several times, and when I see that, these people just never break their bones. They fall, they do all kinds of things, have accidents, they just don't fracture their bones, and it's like, wow. That's the power and strength of things. And sometimes a little hyperactivity is kind of good in some ways, I suppose. Would that indicate that something is working right in my body, since I am pretty sure that a lot of my body does not work properly? I would say that it does indicate a little hyperthyroid, to be honest with you, or parathyroid. Oh, these are nice.
Is that beautiful?
Oh, these are the new, these are beautiful.
Look at the back.
Ooh, that's pretty. These are our new, these are our new brochures for the herbs. These are beautiful. I like that. And then it has all, a definition behind each one of them and some of the traditional uses and stuff of what we use them for. So that's pretty. I like that. Yep, girls did a good job. She's had bad migraines, anxiety, eating disorder, kidney infection, and a few UTIs. Well, you automatically know you have kidney problems, sweetheart. You have low adrenals, not too bad, which is good. So you want to fix that, strengthen the nervous system in the body. You're doing that real good. Move up to fruits. You had migraines. Either clean up the stomach and bowels, because that's where migraines can come from. Get the sinuses drained out here. Get the cerebellum clean. Everything on. Get your glands regulated, and all this is going to disappear on you. Looky here. She had disc problems in lower back. Of course, that's the kidneys right there, tied into the dehydrated skin and everything, to the point that I was almost crippled. Varicose veins, tied and aching legs. Oh, this doesn't show. You know what? These fingernails might just be a temporary thing, because everything else here is telling me you have some parathyroid weaknesses. You're not using calcium well. Varicose veins, your body's highly acidic and you're losing calcium everywhere, it looks like to me. Heart irregularities can be from the loss of calcium, or weak myelin sheaths from the autonomic, or stomach problems, or colon problems. A lot of wax in the ears, candida. Yeah, this is all heavy lymph problems, sweetheart. I have learned very much from your channel and currently eating only raw fruits. Good girl. I would like to do a grape fast, but unfortunately I don't have access to good grapes. When you do. In the stores, grapes are sometimes real bad quality, so I thought it would be wiser to eat other fruit that is better quality. Absolutely. I do eat mono meals only. I don't mix her. This girl is on point, baby. Man, I like this lady. I also take your herbs, but would like to have some advice that maybe I should take different formulas. I'd take the 2 kidney formulas, 1 tincture, one capsule if it was me. I'd take 2 lymphatic formulas, 1 capsule, one tincture. I'd take a stomach and bowel formula. If I could, I'd work with the GI broom with that and clean that out. At the same time, I'd probably take the skin formula for a little while. Upper circuit, brain and nerve, good choices here. I am taking kidney and bladder 1 caps, endocrine caps, lymph 1 caps. Well, make one a liquid. Do the lymph node liquids, parasite M caps. Do that until you get the fungus out of the body, or moles start falling off if you have moles on. Did 2 bottles of brain and nerve, upper circuit, lower circuit. You don't need the lower circuit so much, but go with the upper circuit for sure. Also taking GI broom. Yes, I think this product is very well named. Yeah, it's a real cleaner. I know. I know it. I think I really like it. Pretty scary that comes out of me. Yeah, I know. And that's the thing, is that once you get your lymph cleaning, hydration will occur. Glands that are hyper or hypo will go up or settle down. All these balances will occur, which is pretty cool. I was thinking of adding kidney number 2, absolutely. Lymph node 2, absolutely. And adrenals, absolutely. And I would do the adrenals 200s maybe. You're not that low of blood pressure, which is a good thing. But you are having some anxieties there. And you could have some neurotoxins. No, I think that's pretty good. My kidneys are filtering some, right, but not really enough. So I would like, this would be the priority for me. Absolutely, getting the kidneys filtering and kicking that up another notch. And thank you very much, sweetheart. Thank you so much for that. This is Doug. Hey, Doug, how are you, man? I'm taking the detox formulas in Kit 1 plus prostate, adrenal glands, and eyewash. Can I just dump them all in one big eyedropper bottle? Yeah, you could mix all those together, equal parts. And when you go to take them, shake them up really good and take however many formulas you dump together, take a dropper full of each. So if you dump 4 formulas into a big bottle that you're supposed to take, shake it up real good and take 4 dropperfuls out. You could also, I think, Brian Adams, he travels all the time. I think he uses a teaspoon or something, you know. Once you realize, make it easy for yourself, you just make it easy for yourself. You know, if so, is there anything in the other detox kits that should not be combined together in such a manner? I don't think so. You know, in terms of GI Broom, though, I might want to separate that from my other stuff because it's just a honkin' puller. But outside of that, I don't think there's anything you can't take together here, to be honest with you. Chemistry is all conscious. It all knows where to go. I've actually found that formulas are so much more powerful than single herbs. They just are more powerful. It's like we as a group are much more powerful than one person standing alone. And this is why it's essential we all work together to change the consciousness, because the one can't do it, but the many can. And that's why you guys are really important to the growth of consciousness on this planet. Oh my God. It's unbelievable. This is Tony. Hey, Tony. I was wondering if you could help. My girlfriend is 43 and has ankylosing spondylitis. The doctor has induced the menopause and put her on an HRT, hormone replacement treatment program, and due to a buildup of fibroids and continuing bone pain. They are now pursuing her to have a hysterectomy, which they say will sort most of these issues out. Oh, God. Let's just take out her ovaries and uterus, and this should sort everything out. Oh, my God. I have severe doubts about this. Thank you, Tony, and believe that perhaps a raw diet may be a better solution. Do you think? Tony, you're right on here, but she is very unconvinced with this alternative. What advice would you give her? I would give total advice that don't have your body start cutting up. If you're estrogenic, fix it. Get into the body, get your kidneys filtering, because if you remove your female parts, it's just going to be other places next, and other places next, and other places next. So this is just an area of high acidosis. You detoxify the body, you get herself back. The doctor has induced the menopause. Oh, my God. You know what? You're just going to lose your adrenals, sweetheart, and probably some of your pituitary if you're going to take these hormone replacement things. You don't need to take hormones and steroids. You need to get your acidosis under control, enhance the function of, and make healthy your endocrine glands, pituitary, thyroid, parathyroid. You're getting to the point where ovaries, get your ovaries healthier and your uterus. You have maybe 10 more years. But you want everything healthy there, and then get your adrenals up and your kidneys. Really key to this, and getting yourself healthy again. Tony, you're right on. You just can't cut out your body parts, sweetheart. That's not the answer, and it will not be the answer. It's never the answer to remove body parts, and never the answer of bringing a homeostasis to the body. Doesn't happen that way. And you'll find more problems and the adrenals. Then you can be low estrogen, taking more estrogen, and you'll mess up the adrenals even more. Then you'll get into vaginal drynesses, and you'll get into all kinds of things that you don't want to go there. It's not worth it. Go for health. Get your body healthy. As always, love your videos and love the Facebook guys and gals. Yeah, I love the Facebook guys and gals. I mean, this is where we need to go. This is where I hope you all move and have them help you. If you guys get in a quandary, put them up here, and we'll try to do more case studies for you. We get one. I'm going to try to use that as a case study to help you there. I wrote to you a while back about 8-centimeter tumor goiter on my right thyroid, and you and your office were so helpful and informative. Well, I did do a great fast after, but only managed around 6 days. We'll turn around and do it again. And turn it around and do it again. And turn around and do it again till that goiter's gone. Because we deal with big goiters all the time, and there's no reason you can't get rid of it. Not at all. Let me see. I am 100% raw, good. Mono fruits, perfect during the day, and a salad with an avocado, a treat in the evening. I juice grapes or apples, celery, and ginger and limes. I am also on your kidney and lymphatic formula. Absolutely would be. I would do 2 kidney formulas, 2 lymphatic formulas, clean up my bowels, get your GI tract cleaned up so everything can drain right. You know, go after that stomach and bowel, use the GI broom. Do 1 capsule, 1 tincture of kidney and lymphatics, and really tear this up. Keep pushing yourself into these little fasts. It's okay, you did 6 days, try it again, see if you can do 7. And if you can do 7, give me 8 or 9. And you keep working that till this baby is gone. Make sure you're filtering. I stop the seaweeds as recommended by the office. I use a steam room several times a week to sweat and get outside in the sun often. Oh, this guy's right on. This is Damon. I feel as if my tumor is diminishing slowly. Keep moving, because as you keep getting the kidneys filtering, it'll start going down more and more and more and more, and pretty soon it's gone. And that's why you keep going with this. You keep digging in. You keep moving that lymph, baby, and you keep moving out, and you'll do well. You'll get that all gone. I've noticed new... Said, I feel as if my tumor is diminishing slowly, yet I have noticed new lipomas on my left arm. Well, you got to get yourself filtering. You got lipomas or fatty tumors. You got to get yourself filtering, and that's the key. Your body's using lipids. That's telling me you have some weak adrenal glands, man. So you really want to hit the adrenals and kidneys. Get yourself filtering. Keep hitting that detox. Keep hitting the detox. The lipomas will melt away. Just keep going, keep going, keep going. Make sure this is gone. Very key. So just keep detoxing. Could be on your left side. You're not filtering as well as you could. Which side's the tumor on? On your thyroid. Is it on the left as well, or you have, maybe the left side is a struggle to get it filtering? My blood pressure is a little on the low side, averaging about 105 over 55. Yeah, but he feels great. Well, you know what? 55 is low, so I consider that low kidney function. 105 is too low adrenals. So, yeah, you need to perk up the kidneys like you're doing. Perk up the adrenals. Keep going, keep going, keep digging, keep digging. That's how you get this done. And you just keep detoxifying that body. Go after the bowels a little more aggressive. I'm 6'1" and now 136 pounds, a little on the skinny side. But you know what, man? You get this. You got to get absorption. You got to get all these things going on. It could be a clue to why this is that you have malabsorption with this. That's why always work, guys, on the GI tract too. There are some fundamental areas you're always going to work on. Kidneys, adrenals, always the GI tract. Always the endocrine glands. Always. Every case. Always. Not an exception one. If it's a child, you use 1 kidney formula, 1 lymphatic, 1 endocrine gland formula. If it's an adult, hit them harder if you have to. Whatever it takes for them to open up these doors. Use the GI brooms. Use the stomach and bowel formulas. At the same time, turn up the nervous system if you have to. Brain and nerve. All these things are part and parcel to moving your clients to Wellville. And you just keep digging. In a case like this, you keep inspiring them to do deeper and work deeper into these grape fasts or a lemon juice. Give me a 5-day, 10-day lemon juice fast. You keep him moving. You keep him detoxifying. And before he knows it, he'll turn around and that tumor and goiter will be all gone. And the lipomas will melt away and everybody's good. And with a 6'1", you might suggest that there is transverse colon problems and a little pituitary. It's possible. It's possible. So that's something that it takes you back to the colon again. And since this all affects this, you've got to clean up the bowels to get the tumors to drain. So it's all kind of tied together. You need the kidneys to filter, you need the bowels cleaned up, and you need this, and that'll create a drainage. My kidneys are filtering, but I do not see the white stuff after 30 minutes, but I do see loads of it after 24 hours. Wow. Just keep honking. Keep honking, man. Hoping I'm on my way to Wellville. You are on your way to Wellville, my friend. You're doing a great job. While you're in the heat of this, try another 6-day grape fast. See if you can move it to 7 or 8. And you keep working this. You're not starving. There's plenty of food, and you just keep eating small meals more often, whatever you need to keep going and to keep moving yourself down this. If you have to, do a day or two of just water fasting. Keep moving yourself toward that, to where the body has the power to open all your doors and to kick this out, and then you'll be there. You'll be done with this. Everybody seems different. Some can water fast easy, and exactly, some are, and that's true. Everybody's different. They're different emotionally because they're different genetics and adrenals. Everybody has different ways they see themselves because of the thyroid and parathyroid. So, yes, that's the beauty of life is individuality. And that's why this is an art. This is why you guys on Facebook are doing such a good job. Don't freak out. Everything is up and down always. And this is how you develop the artfulness of detoxification. Know when to hold them, when to fold them. Those that can't go long, pull them back, balance them out, expire them, go a little deeper the next time. Keep working them back and forth, and before they know it, they've achieved their goals. And that's, you just keep working people into this sort of thing. Can you slow detox as well as fast detox? Absolutely. You can go slower, but with a goiter and a tumor, I don't recommend it. Nah, get it out of there. Get it done before you break down any thyroid tissue. Get this out. Get these lipomas. You're too acidic, so you need to get these things going. What I mean is if you are raw and on herbs but not fasting or 100% fruit, you are slow. Well, no, that's probably a pretty fast detox as well. When you're facing tumors and things like this and goiters, I like to put the pedal to the metal. I really do. Get it out. You know, that, and then you're done. And you made such a difference to the human body. You just set the rest of your life up to live in Wellville. And this is the key. Do it now. Do it now, Naaman. Do it now. All right? Also, if you are older and come from backgrounds of smoking, yeah, bad diet. And that's a problem. Some of us over folks, not me, I love discipline like that. But some of the older guys, they just, no, I can't do that. Some of my hardest cases are the older guys, and it's just trying to keep them from stroking and heart attacking because you know they're not going to do all raw. They're not going to do all fruit, and yet they keep coming in for your help. And it's like you did the same conversation with them every single time. You know, and it's like, here we go. Let me just push the record button and sit back and listen because it's the same thing. But you know what? They just need a little shot in the arm. They just need a little hug. They need to know someone's on their side because the mind has been conditioned in grooves. And it's hard to break these records, these photographs, these grooves of the mind, these habitual tendencies of the conditioned mind. This is why to know truth, you must leave the world of the mind. It's a conditioned instrument. Leave that world and visit consciousness. That's where all life is. And then play with the mind if you want. Yeah. As far as everyone's path is at the mountain to Wellville is different, and it is different, man. Don't beat yourself up. And then just like you said, karma allowing, whatever that is. But bathe yourself. Bathe yourself in the essence of the awe. In the essence of spirit or the prana or the life force or whatever you wish to call it in your own understanding of that which is all life, that which is watching behind the scenes of how the drama is being played, that which is the infinite, and that which is you. And the only time you can visit those is keep that mind over there, keep the desires over there, and live in that now. Just take the day and make it your day to just be and hang out with yourself and just watch life go on. You don't want to always be involved in it. You don't have to always pull yourself into life. You can sit out on the edge and watch it. Thanks for the tidbit, man, and keep going hard on yourself. This is the same one. Good. A case study for your YouTube video. Okay. Here's a case study. All right, let's do this one. Gosh, I'm not getting as much done as I thought I could get done. Holy moly. I only have a few more minutes, so let's do this case study together. This is a 77-year-old female. She has Alzheimer's. She has cirrhosis of the liver. One kidney, left kidney, right kidney removed. Ugh. She is currently, you see what I'm saying? It always comes back to those kidneys, don't it? There's those kidneys, so she's compromised on one side of the body. If the surgeon hooked up her lymph vessels properly and everything, hopefully she'll drain fine, no lymphedema. We'll see how that is. Now, the cirrhosis of the liver. Now, here's the problem. The liver is on the right side, predominantly, of the body. And which kidney did she have removed? The right kidney. So you see our problem already? Right? She is currently receiving care within a nursing home. Her son is very active in caring for her and ensuring that she stays within the perimeters of a raw food diet, which is a good man. I mean, when you have a son that's taking care of his mother like this, that's a man to have. Now, ensuring that she stays within the perimeters. The facility is giving her herbs. I think I know this case. She has been 7 months raw with a last couple of months on herbal formulas. Fantastic. She grinds her teeth almost constantly, resulting in severe damage to the teeth. She is mostly in bed, but is able to move a bit around. She has some muscle agitation, though it is not considered cramping or tremors. Recently, she developed a severe rash all over the body with fungus appearing in the left underarm. Okay, so let's go to the Alzheimer's first. You know immediately that her sinuses and her head area is full of inflammation. Mucus, pus, all of that. You know that her brain synapses, her brain function has been suppressed by inflammation or acidosis. You know she could have some brain lesions or not. Doesn't matter. In dementia and Alzheimer's, you're at the top of the heap of what you need to do to regenerate this case. And it is, thank God that this man is willing to help his mother, and the nursing home facility is willing to go along with this. More nursing homes need to go along with their kids and allow them to get their parents healthy and out of the nursing home. So upper circulation and brain and nerve are going to be two key formulas always in dementia, Alzheimer's, forgetfulness, cholesterol plaquing, post-strokes, pre-strokes. I mean, these are two formulas that are instrumental in all these type of upper head problems, from everything, from eye problems to everything else. I'd also deworm this lady. Kill the candida out of her, so I would keep her on a parasitic like Parasite M for a while. I would do Parasite M and G in capsules for a duration. I know that one of these cases, this might be her, he doesn't want to give her formulas because the nurses have to give them to her. And that's true. He's got to ride a fence here. I don't know if this is the same case, but you got to ride a little bit of a fence there. But deworming a person because the grinding of the teeth is a good idea. I would also use the antispasmodic along with the brain and nerve number 2. I would use an antispasmodic to keep the nervous system relaxed, because she's highly agitated neurologically. That's acidosis. It comes from the central nervous system, goes through the cerebellum to the parasympathetic or autonomic. Then you got a GI tract in these older people that are messed up. You got kidneys. Of course, this lady already lost a kidney. Now, the other problem, we got to save this last kidney. And you might want to see where her creatine's running and everything else, but that's where you want to get her off of all the milk. I'm very familiar with nursing homes. Had my mom and grandmother in 2 different ones simultaneously, so it wasn't a lot of fun. But I also spent years at it was a Catholic hospital, St. Joe's, and then they had a nursing home, which was where my grandmother ended up, and that was the best one. These nuns were so good, unbelievable good. So you really want to use those formulas there. You want to use at least 1 kidney formula, and I'd probably use 2. I'd use a capsule, number 1, and then number 2 liquid. I'd only use 1 lymphatic formula, I think, right now, because she only has 1 kidney. So I would use like a lymphatic capsule, which will clean the bowels. So a lymphatic 1 would be good for this lady. 2-3 times a day, generally on these things. I'd also do a stomach and bowel number. If she's a little constipated, being sedentary, go to a number 2 or a number 3. But keep her bowels moving regularly, at least twice a day. At the same time, work on getting that kidney filtering. Also, the glands. You know, the glands in an older person are down the adrenals, so you want to have something for the adrenals. With a case like this, I'd definitely probably use a glandular and use raw adrenals, probably 200s. She probably has high blood pressure, somewhat with this. So you know you want to work on that. The fact that the right kidney's gone and the right side of the body's in trouble. Remember, what is this? Cirrhosis. This is all about acidosis, and you should be able to pull that right out of her liver. But to get that, you've got to get the kidney filtering. Well, she doesn't got a right kidney, so hopefully the surgeon hooked up the lymph system to the other kidney, and now that one kidney has got to also filter right side body, because the right side has to have a way to filter now. And if not, her skin's going to look real bad coming up. It's why I think you see that her skin is breaking out, is that the problem has always been with her kidneys. She hasn't filtered. That's why the Alzheimer's in the first place. And it's not timers. There's no T in it. So you got to realize that the problem in the first place is the kidneys and adrenals. So you got to fix the one kidney that she has and the adrenals. Make sure her basal temperature's up, the thyroid, parathyroid, in someone older like this. You want to make sure a parathyroid, probably wouldn't hurt to give her a bottle of parathyroid with kelp. That way you're going to strengthen up her connective tissue, keep her from petechia at 77. She's got to be bruising easy and things like this. So those are some of the things you want to get in and fix, is get her parathyroids up and her thyroid, check her body temperatures, get her kidney filtering, get her adrenal up. She probably only has one adrenal too. So you work on those. Liver gallbladder formula would definitely be important here. And I would say that hopefully, if everything's filtering, she doesn't have a lymphedema on the right side of her body, she might have a good chance to pull this cirrhosis out and fix that liver right up. If she's not filtering and she has lymphedema, you might be struggling to accomplish that. So you just have to see how this lady responds with that. But I can tell you this, you can get this mother back in shape. It might take you a while, but it sounds like you got the help of the nursing home behind you, the help of the nurses. And if these nurses and nursing homes and the medical doctor that runs this nursing home, if they see someone coming out of this, it might be the thrill that turns on and opens up a lot of good doors for a lot of people. And that's what's needed. I think I told you about a case where the mother and son came to me. The father or the husband, however you look at that, was been in a nursing home for 2 years, hadn't spoken. I think he had a feeding tube, bedridden, of course. And that was in June or July. I had him at home for Christmas, playing with his grandkids. And that's what that's about. Well, I love you guys, and I've got to run. But you keep working on your health, your family's health. You all have been gaining a knowledge that's incredible. I love you guys, your understanding. I'm just here to help as a way shower, to help you put these together. I think we all make a beautiful team. You guys, I love you. You Facebook people, shout out to every one of you individually. There's so many great souls involved here. I just, each and every one of you know I love you. Every one of you. Thank you so much, Angel. Shout out to you again. All you guys are good. There's several angels out there. Matter of fact, I see you all as angels. And that's just what we're here to do. So I love you all. You have a fun day. And detach from those bodies for a while and have some enjoyment of the celestial consciousness, if you will. We'll see you. I'm sorry, guys. I'm back here again with you. Chris just handed me this one that just came in. I thought this was important to read this to you and to add this on here. This is from Be Free Green Energy. Love it. Harry, this is the phone number we'll give Jen B to. This is, hi, my father has lung cancer which has spread. Do you have anything that could help him? I wanted to find out if there is a good naturopath in Connecticut. I have read the Gerson book and have given him mushrooms. Turkey tail mushrooms, never heard of those, is still spreading. I know it, because that's not going to move his lymph system. Is there anything you can help with all this? Doctors are very stupid in Connecticut. This is Harry. Harry, absolutely. I don't know where your father is at on this, but I'll tell you this. You got to get him on all raw, number one. So there's a move to move your dad into an all raw diet. If he's older, Good luck. But let me tell you, let your dad see this. We've done a lot of lung cancer cases in here. Not that we're treating lung cancer. We're after the health of the individual, right? Right. So what you've got here is you've got masses in the lungs, I take it. So you want to move. This is all the lymphatic system again. Remember that? So to sit and explain the lymphatic system to your father. Get his kidneys filtering. Your father's going to have kidney problems. This is the problem. So you're going to go after the kidneys aggressively. You're going to go after the bowels. You want to do lungs number 2. I also would drink, and here's the thing you have to be careful with guys with lung cancer, is too many liquids. When his father is too involved here, he's going to start filling up with fluid in the lungs. He'll have to go get aspirated every once in a while and have this fluid pulled out because it cuts down his ability to breathe. So you got to be careful with the teas, but there's a 3-lung tea that if you just did a quarter of a cup, or less, off and on through the day, it breaks up hardened mucus. Now, a lot of this he's going to cough up and he's going to come into bronchial or pneumonia type symptoms. So what? He's going to be coughing up nasty looking stuff. Going to be a little blood and mucus, yes. And you're going to see some yellow, some green, some brown, and maybe even some black stuff coming up out of his lungs. I would be aggressive with this dad of yours. I would do the 2 kidneys, the 2 lymphatics, the GI broom, the stomach and bowels. You definitely want to do the lungs formula. You are cleaning, you are opening. If you have to, you can use some castor oil treatments to the lungs just as an anti-inflammatory purpose, but you really want to get this dad. And if you can move him and he wants to live, then I would get him up on thinking grape fasting and put him on a lot of grapes. Juice them, eat them raw, I don't care, but your dad needs to go on an extended grape fast. And if you can move him toward that, I'd move him sooner than later. Get him on these herbs sooner than later and get your dad going. Tell him to relax and start changing his diet yesterday. Get him all on fruits, berries, and melons. Forget the salads. Use that for a day or 2 and then get him out, because it's not that it's spreading on him. His lymph system has been backed up for years. It's just all the hot spots are going, hello, I'm here now. Oh no, I'm here. Oh no, I'm here. It is not moving. It is exploding because it's a systemic problem. Remember, when your lymph system backs up, it's a systemic problem. So go after your dad lymphatically, aggressively, and you'll be successful. So I just wanted to get this on there. Sorry for this little ad, but we need to get this on here because we got a man in trouble that needs to get his life back. All righty. Thank you again. Thanks, Chris, for bringing this to the attention. I'll send this to Gen B, and we'll see where we can go with that.
Perfect.
Bye-bye.